Hi everybody, welcome back to Laura A Vlogs. I am recording this video on Tuesday, July 22nd. It's been over 2 weeks since I mentioned I was going to get back to you guys regarding to what is going on regarding to the follow-ups and what's the test results of my blood work. And unfortunately, my doctor failed the assignment. She was supposed to get back to me a few days after the test, by blood test that was taken, and she thought that she already sent me the information to me, and she didn't. And so I wound up reaching out to her, and since she's been on vacation, she reached back to me this past Sunday, and at least she responded. But I'm in a good spirits though. But it's not like, oh, everything is fine, because it's not. It's pretty not. And it's been pretty rough. My breathing has been a little bit difficult. I've been coughing a lot, and unfortunately it's been a little bit of a hard journey in getting better when it comes to my health and stabilizing my health, because after all, with UCTD, unfortunately, it wants to kill me. and if I'm smiling about it, it's because of the fact that I'm trying to keep a sense of humor about it, but in reality it is true. Unfortunately, with this disease, it's taking each part of my body slowly, and if I was to sit down and think about it all day long, I think I will become severely depressed. But the thing is that I'm refusing to let that take over my mind. And like I mentioned in the past video, keeping myself active is really important to me, because if I were to let my body break down, then it's just basically I will give up on life. And so I refuse to do that. And so, like I mentioned, I was supposed to get a call from my doctor, and she didn't get back, and she thought she called me, which she didn't. And so when I reached out to her, she got back to me last Sunday. And because I already saw the blood test when I did the video to talk about what happened in my primary care, I already saw the test results the next day, but I couldn't say nothing about it because of the fact that I wanted to get a confirmation, okay, what's going to happen next. And so that day when I got the test results, and I have it open in my chart, so I'm gonna give you a small breakdown because there wasn't too many things to talk about. So it shows that my lipid, anybody who takes blood work that has issues with lipid, is practically the blood work for to check how your arteries are doing, and the blood flow in your body. So it showed that my cholesterol was severely high. The normal value was on that test should have been 199. Unfortunately, it showed up that I had 235 high. My triglycerides supposed to be 149. It was high as well. It showed 246. My HDL cholesterol, in order to have a normal 50, mine came low, so it was showing as 45. And so like everything else was semi-okay, but the problem is that, let me see, 49, 104. So in my LDL cholesterol, So it's showing I have a range of cardiovascular risk assessment recommended, recommending lipid lowering therapy with history of diabetes, because when they took the blood test to check if I have diabetes, because after all, my family had diabetes, it runs rampant on the women's side. When they took the blood test to see if I have diabetes, it didn't show up as having diabetes. So my blood range was normal, because I don't really, I take care of myself regarding to what I eat. And that was the funny part, because of the fact that, you think, well, the person who has problems with cholesterol will also have problems with diabetes, especially when it comes to my family history. And unfortunately, with me, it comes with a risk. But I didn't get diabetes, like my blood work for the test for diabetes was everything normal. So I was really happy to see that. And then when they took the blood test to check my sodium levels, because also I was concerned about that too, and it showed everything was normal. So it was just the fact of the lipids were, out of control, because then it shows the chol HDL ratio. So in order to have a range between 0 to a 4.9, mine was high to a 5.2. So it's just showing that there was something really going on with the arteries. So I pretty much, wanted the doctor to confirm, okay, what's going to happen next, which I already had a feeling what was going to happen next, but I just wanted to get a confirmation. And then when I saw the C-reactive protein, that is the test to check out for the inflammation in my body, which like I told you guys, I've always had this disease with the UCTD. So when I first got diagnosed, my C-reactive protein was like always out of control. So I guess she had a doubt in the mind that it was that, but when it showed that it was high as well, because a normal range will be like a 4 milligram, but mine came out to 11, so she was really surprised to see that. And she goes, well, that confirms what you're going through. And I'm like, duh. It's like, I know my body when it's not right, and that's why I tell you guys to make sure you advocate for yourself. When you feel your body is not well, trust it's not well, and you make sure you be very vocal on how you tell your provider, your medical provider, hey, this is not right. I'm going through this, issue. And make sure you become very detailed on the information, because, sometimes doctors, they raise an eyebrow. And like I mentioned to you on the last video, she at first was raising her eyebrow to see that maybe I'm just making things up, and I'm not. And sometimes you gotta put your foot down when it comes to getting your information across correctly. Now, when she mentioned to me, well, when it comes to the inflammation, and this is what she told me on last Sunday, she's gonna leave it up to the rheumatologist and myself to decide what exactly is gonna be the course of treatment for that. Because obviously, she can't prescribe me just, a Motrin and call it a day, because this has been progressing a lot throughout the years, because of the fact that you guys have seen the various conditions that I went through with COVID, then with the breast cancer, and then catching COVID again, and then going through all these other things. It just leaves me thinking, okay, now we need to tackle this down, because I cannot let this illness finish me off, and practically leave my family, pretty upset, because doctors are failing on me, so I can't let that happen. And so I said, okay, we'll leave it off, because I made the appointment. I spent that week after my visit calling to making sure that I confirm my appointment with my rheumatologist, because of the fact that they, I knew the booking was going to be, months down the line, because I think I told you guys, oh, I'm projecting it maybe December. And then sure enough, they told me, well, we have an opening slots in November, and then they placed me on a waiting list. So I did note it down. Did I note it down? Oh, I don't think I did. Shoot. No, I did note it down. So I have my appointment with them November 19 at 2 p.m. So yeah, I'll be going there. It's on a Wednesday, so I'll be having my first official appointment again. So most likely I got to do my homework assignment and making sure that I note down everything that I've been through since 2019. And that's going to be fun to type everything out. And yeah, and just see what's going to happen next with that. And then I was able to also make an appointment to get my new rheumatologist, because my old rheumatologist, he left the practice in May. So I wanted to make sure that I have a new rheumatologist, and I think I didn't put that information here, but I know my appointment's on the 9th on Tuesday, so most likely it's going to be probably I would say maybe 1 o'clock, because usually it's around that time. So I was able to get the appointment in, and then yeah, I'm gonna meet the person for the first time, and I think that will be an interesting moment in my life. So in the meantime, my primary care is gonna do is for the lipids, to pretty much try to control that. She wants to prescribe me more medication, and she wants to add statin into the list of medications that I'll be taking. And so she wanted to know, since she couldn't do the conversation through email, she wants to give me like a little conference call and have a chat about the different choices of medications for the lipids, for that statin so I could take. And I told her, since my schedule has been a little wonky this week, I told her to give me a call for tomorrow after 3. So tomorrow will be Wednesday, July 23rd, and have a conversation on the different choices for that type of medication. In the meantime, I will be sitting down in a little while and researching thoroughly each of those medications to know what will be the better fit for me, because I know each medication has its risk. And I remembered when my mom, she had to take her medication, they had prescribed her Crestor, and at the time that was the medication that was becoming popular and I remember her having difficulty even dealing with that medication, because I remember she says that it was just giving her a lot of burning feeling in her body, and so her medical doctor was not paying attention to what she was talking about. So now I'm going to sit down, check the different options that each medicine has, and what are the positives and negatives, so I could just figure out accordingly what will work well for me personally. And I will be paying attention to those side effects. So I won't have that information now, but eventually maybe if I'll probably do a future video and let you guys know what medication I decided to take and how's it working for me. In the meantime, I have mentioned to you guys that the doctor had increased my blood pressure medication. So before I was taking the lisinopril HCT 20-12.5 milligrams. This medication I've been taking for a while, but now that my blood pressure has been elevating more and more, so she decided to do is increase another dosage. So now I've been taking one in the morning and one at night. So I'm already due for the night one. After I get done with the filming this video, I'll take the rest of the pills that I'm supposed to take at night. So I'll be taking that twice a day. So one in the morning, one at night. And then I told you guys I started with the Lyrica. Now, the Lyrica dosage is a 25 milligram caplets because of the fact that I mentioned that I wanted to start very low because I wasn't sure if I were to start with a higher dosage, how will it affect me physically? And luckily, I decided to do it this way because of the fact that I didn't realize how strong for a smaller dosage was for me because I am very sensitive when it comes to medication. So I started the Lyrica the day after. I think it was the day after or Wednesday. Can't recall. So they gave me the pills. So they gave me the pills, like one capsule 2 times a day. So basically 2 pills a day. So I take one in the morning and then I take one at night. And what side effects I noticed that it gives me is that I become very exhausted. I get very sleepy. Okay, so that is a little rough. I mean, at nighttime is perfect because at least I could sleep it off. And I still get up kind of groggy. So now, since they discontinued the trazodone, pretty much the Lyrica has replaced trazodone in a sense of me falling asleep. So it's kind of rough in the mornings because I feel a little tired and I become a little loopy. So I have to be very careful how I handle myself as I, go about my day. So that's the type of medication I've been taking as of lately. Like I mentioned, it just gives me sleepiness. Has it subsided most of the body pains and the pressure points that I've been experiencing? Not really. I notice I still am feeling slight pain, but I'm also thinking about it could be also with the problem that I have with the inflammation in my body that is out of control. So it's going to do whatever it's going to do. So it's a matter of how can we adjust both in the body. And that's my question. And I think once I see the rheumatologist, I'll definitely be asking all sorts of questions about it. But this is where I'm at right now regarding to my illness. And yeah, so right now, like I said, I will be waiting for a phone call. I'll eventually do a later video sharing what medication I'm starting with. But in the meantime, I'm going to do a little research and have a conversation after that and see where we go from there. But I'm trying to fight really hard to get better and keep my body under control, because that's the problem. When you are going through inflammation after inflammation, it's not easy because it's practically your body's doing its own thing, and no matter how much you want to keep it under control, it's sometimes the body's going to say no. I'm going to do what I want. It's like my I feel like my body has become like my little small child that wants to throw a tantrum. And I'm trying to like, no, you're not. You're going to listen to me. I'm the parent. But, you know, it's one of those things that I am going to keep fighting. It's been rough because physically I've been feeling really fatigued. And especially the weather here in the city. Oh my God. The breathing has been really, really off. It's been really terrible. And now that I'm become more scared because we are reaching this weekend. On Friday supposed to be 99 degrees and then Saturday is going to be 102. And me as a person who's been having difficulties in breathing, it's going to be terrible. And I'm supposed to celebrate my son's birthday. And we're going to try to figure it out. How can we have a good time without having my body go through a shutdown and collapse? So that's going to be the bigger challenge. So we're going to see how we're going to do this. How, you know, we're probably going to do it Friday, but still this is not going to help regarding to the weather. But we're going to see how we can do this and make a best of it of the day. But yeah, this is where I'm at. I think I rambled enough. So yeah, more to come. And I'm going to continue fighting. So anybody who is going through this, please know that, like I said, be your own best advocate when it comes to your health. Because you are, you know, going through these symptoms. Because, you know, we all going through different various symptoms when it comes to UCTD. But the thing is that we have to make sure we keep our, you know, jot down the information, you know, bring a record of everything that you've been going through, and really stand firm in making sure that you get your point across. And it doesn't mean to be disrespectful, but in a sense of like, hey, there's something really wrong and I really need answers. And you know what? You are paying their service for them to provide help for your body. And so it is your right as a patient to get the treatment you need to control your illness. You know, it's not like you asking a favor. It's not a favor. It's a requirement. So anybody who's going through this, don't give up. Anyway, that is pretty much it. That's pretty much it. Anyway, so if anyone sees this video, you guys know what to do. I can barely even speak because it's almost 11 o'clock and I'm exhausted, and 11 o'clock at night. Anyway, so if you see this video, you guys know what to do. If you are new to the channel, you're very much welcome to subscribe. And I will catch you guys soon on the next vlog. Bye.